Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
Yeah, go ahead.
So it was a lot of hats, because when things come up, we had a wellness program. So wellness programs came in at this time, and I know Johnny, software engineer, is not going to lead the wellness program. It was a small company, naturally.
Yeah,
it's like last man standing.
Yeah.
So
yeah.
I guess I'm doing a wellness program,
Yes, but that's tip of the iceberg. So when you're, if I could have you just kind of think back to, the beginning of that, what was kind of front and center? Like when you think about the role of HR, and I know it's going to vary from industry to industry, and it's not necessarily a cookie cutter, one size fits all answer. But what do you see as the primary function of an HR leader?
To take care of the people. I think I am a firm believer that employees are my customers, and any organization is going to have customers, I assume, and customers is number one. You always hear that. Take care of the customer. Your customer is number one. Well, the employees are my customer. I take care of them, whether it's a dishwasher in my current organization, or if it's our CEO. And some of them have similar questions. Can you give me a copy of my benefit card? Or, some of the questions do get more unique and complex, but just to take care of the people there, whatever that may be. It could be something I could do to take care of them, or I might know who can take care of them better. If they have an accident at the site,
right.
I'm not in the workers' comp, but I know who to call for them, and oftentimes I'm just their first line of defense. Help me. And then that's my job, is to just help them with whatever they need at the time. Maybe it's career growth, putting together KPIs and career ladders and salary plans and whatnot, or if it's recruiting, helping them staff their workforce, helping the leaders to staff their workforce, benefits, making sure they have good benefit plans. There could be so many things in HR. The size of the organization plays a big part of that. Smaller organizations, that HR person is going to be doing a lot more. Now I'm in a larger organization. We have more siloed functions. I don't really get into recruiting a lot at all anymore, but
in your specific function and role, but obviously recruiting is important, and you have someone that's focused on recruiting.
Oh, we have a whole team for it. Yeah,
exactly. Right. You're not part of a multi-thousand person organization, and recruiting just goes away. Right. You're always on the constant lookout for new talent, hiring and keeping an eye out for best of breed and all of that stuff. So, would you describe yourself as more of a macromanager or a micromanager?
Oh, I would say a macromanager. You'd have to ask my team. I really give people the reins.
Yeah.
To do what they are an expert at. And I guess this goes back to my experience at that engineering company. My first manager, and she was the other person in HR, and she was pretty quiet and went through this tremendous growth, like this oil and gas boom. We just quadrupled in size within a couple of years. And this woman was, I just can't say enough about her, would just drop things on my desk. I'm like a bakery manager 1 month ago, and she would come over and be like, just take care of this, and hand me this task that was, I couldn't even tell you, creating job descriptions. They seem so simple now, but at the time I'm like, I don't even know what a job description is, and she would give me tasks. And I think I growed so much in my career at that time, just having the freedom to figure it out.
Yeah. If someone had a need and it was a life or death situation, what does one do? And have you encountered situations like that where you've had to make a really hard decision about an employee that, really it was like, hey, if they don't get this drug, the days are numbered. I don't know if you've ever come across anything like that before, but
Thank God, no, no,
right.
because
Yeah.
I'll tell you what,
Talk about a
no,
rough day at the office.
yeah, yeah, and I can't even, I couldn't imagine. But those are decisions that they are coming, and I'm sure they have come to organizations, especially when you get in cell and gene therapy and just the increasing cost of drugs. And it's which is, I'm so glad you're doing this podcast because it's such a broken industry. Like drugs are just getting so much more expensive because they're curing more complex diseases. So this is good. And there's so much research and development. And so they come at a cost. Like I understand that.
Yeah.
But the cost is unaffordable to regular people. Now so then the companies are left on the hook because really the companies or the employers are the only payer that can pay at that scale. So now companies are facing these increasing costs, and then it's the whole economic trickle. Paying wages becomes more expensive, and the cost of doing business becomes more expensive, and then the cost of goods becomes more expensive. And I don't know how to fix that. I certainly don't want to stop making good drugs.
Yeah, and I don't think that's the answer. I don't think we have to stop making good drugs. I think by and large, the drug manufacturers are not necessarily the villains in the story. Sometimes, the cost to bring drugs to market is, just unbelievably costly, like super, super, super costly. And the only way to have innovation and have these drugs produced, to get them through trials, get them approved, get them out there to the public is to do this dance that literally can, cost the company billions of dollars. And so now they have to recoup their, investment and find profitability. But that's not the problem anymore. The problem is we've now kind of shifted them to these high deductible health plans, and we've kind of piggybacked HSAs and HRAs onto them, and these people can't afford to access coverage.
Well, we don't have high deductible plans because exactly that. Our people won't go to the doctor. If they know that they go to the doctor and they're going to get hit with a $200-300 bill, they're not going to go.
Right.
And I generalize.
Yeah.
But
no, you're
I'm
right.
guilty of that. I am guilty of that, hands down.
Me too.
I had a burn on my
dirt
arms.
on it.
Yeah. I know. I should probably go get some burn cream. But you know what? I don't even want, and I don't even have a high deductible plan. But I just don't even. People will avoid care, so that's something we have avoided as an organization. And you got to thinking about the workforce. But I understand where you're going. And
well, I think the key though is if it, I think that when we started talking, we kind of painted a either or scenario, right? Bottom line or quality benefits. And I do think there's a third box, and I think the third box is both. Yeah. And what are some of the things that stand out to you in terms of, if you look at your time here with your present employer, is there anything that you look at and say, you know what, we did pretty good there, like I'm proud of this?
I think that our plan is very traditional. We have 3 different plans, and they're traditional PPO plans. And I am happy that is the way that we construct our plans. Not having a high deductible plan. I came from a high deductible plan, and I was a little pissed because I had this HSA that I couldn't transfer, and then I have to pay this management fee. So I was a little bit mad at first, and then I thought, this organization, I think, would deter care. And because everybody does, not just these team members, but a lot of people on a high deductible plan just don't get the care.
Yeah.
And then it snowballs because now they have stage 4 cancer because they didn't go to any of the, preventive appointments or whatnot because they were afraid that it might cost money. And now they have a disease that's, super expensive. So I'm proud of that. I think we manage the plan dollars well. We have affordable options. We still have a wellness plan. We have incentives for people to get their preventive exams. Just go to the doctor. Just get one preventive exam, and you can save a lot of money on your premiums.
So you have an incentive for employees who go to get premium dollars back.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.